Mr. Jacob. So what is your expectation from the union budget?
Well, in terms of health insurance, my expectation would be, a clear vision being spelled out by the new government in terms of how they could help the industry expand and increase penetration. And, they could do a few things which could certainly help the industry to do more and thereby cover more number of Indians in terms of health insurance coverage. Example, I think there is a big issue in terms of awareness of health insurance as a tool to finance healthcare. Apart from select people in tier 1 and possibly some people in tier 2, below that not many people understand health insurance and how it works and how it could help them solve their healthcare costs. So I hope there is a commitment in terms of raising awareness in some form or another, either through funding or helping promote in one form or another through the insurance industry or otherwise. The second thing is they could raise awareness by sort of increasing the incentive to invest through the income tax, relevant income tax sections. And I think the current limit is a bit outdated, 15,000, and maybe it should be around 25,000 because the cost of health insurance also has gone up, and that could help in another way to increase awareness. The third one is related to the price itself. When everybody suggests that healthcare is a topic of great importance, healthcare is something which needs to be available to all citizens of India, I find it difficult, in terms of accepting things like service tax on a very important necessity of every human in this country. So I'm hoping that the current government would relax service tax on something like health insurance premium, thereby making it a little cheaper than what it was, which could again be an enticement for people to invest more in terms of health insurance. So broadly speaking, these are the three things which I'm hoping will get more visibility and clarity in terms of the finance minister's speech as well as the budget and the bill.
And the bill, right. Right. For a layman, what would be the criteria in selecting healthcare solutions?
Yeah. Health insurance, I must say, is not the easiest of subjects for a layman, as you said. And that is why in our own company's case, Apollo Munich, our tagline is "Let's uncomplicate." And so we're trying to make it as easy and simple for a layman to understand what he or she should be looking at before buying. So really they should be looking at things like, what is the coverage? What are the exclusions? Because most policies will have some exclusions, right? What does the waiting period mean? Is that explained clearly? And for what disease is the waiting period, for what weeks or months or years? They should clearly understand in terms of which are the hospitals which could be utilized by the customer if they were to buy. They should understand how does the renewal process work. So I would say these are a few things which they should look at. And apart from this, they should also be aware and clear upfront whether there are any sublimits to any treatments or services in hospitals based on the policy they are buying. These are the commonly misunderstood or not so well explained, and if a customer were to specifically ask these questions before he or she bought an insurance policy, I think they would be much better off.